This is Psychopathology revision for Paper 1. Paper 1 is worth 96 marks and takes 2 hours. This is alongside social influence, memory and attachment, and you also need to be revising research methods alongside this as it can come up anywhere in Paper 1. Psychopathology is worth 24 marks and will take 30 minutes. According to the advanced information, we need to be aware of definitions of abnormality, the behavioural approach to explaining and treating phobias, and the biological approach to explaining and treating OCD. So we'll start with definitions of abnormality. Definitions of abnormality. So we need to look at deviation from social norms, failure to function adequately, statistical infrequency, and deviation from ideal mental health. We will start with deviation from social norms. So, deviation from social norms. This is when a person behaves in a way that is different from how we expect people to behave. Groups of people define their behaviour as normal if it agrees with their sense of what is acceptable or the norm in their society or culture. Within societies, we have explicit norms, which are rules that are governed by law, and implicit norms. So an example of that would be queuing, which is an expected behaviour in the UK, but you wouldn't be arrested if you chose not to queue. You would just be seen as a rude person in our society. Norms are very specific to the culture we live in. There are very few behaviours that we would consider universally abnormal according to the deviation from social norms explanation. This is because norms are specific to cultures and generations. An example of a norm that differs across cultures and generations is homosexuality. So it was considered abnormal in our culture in the past and continues to be viewed as abnormal and illegal in some cultures. An example of a behaviour which would be seen as more universally abnormal according to the deviation from social norms definition is antisocial personality disorder. This is when someone is impulsive, aggressive and irresponsible. An important symptom of antisocial personality disorder is an absence of pro-social internal standards associated with failure to conform to lawful and cultural normative ethical behaviour. So they do not conform to social moral standards. This behaviour would be considered abnormal in a very wide range of cultures. So it's not as defined by generations or specific cultures, because one of the criteria is that they fail to conform to cultural normative ethical behaviour. So that if they fail to conform to that moral, ethical behaviour within their culture that they live in. In evaluation, one strength of deviation from social norms is its usefulness. So deviation from social norms is used in clinical practice. For example, the key defining characteristics of antisocial personality disorder is the failure to conform to culturally acceptable ethical behaviour. The signs of the disorder are all deviations from social norms. This shows the deviation from social norms criteria has value in psychiatry. So it's used in real life and it has a real world application. A limitation of deviation from social norms is the variability between social norms in different cultures and even in different situations, as a person from one cultural group may be labelled as abnormal without considering their cultural background. So, for example, the experience of hearing voices is the norm in some cultures. It's seen as a message from ancestors, but it would be seen as a sign of abnormality in most parts of the UK. Also, even within cultural context, social norms differ from one situation to another. So, for example, aggressive and deceitful behaviour in the context of family life is more socially unacceptable, so that would be seen as abnormal, than in the concept of corporate deal making, where it is seen as a normal behaviour. It's therefore difficult to judge deviation from social norms across different situations and different cultures. So this idea that, say someone from the UK is diagnosing an individual who's from a different culture where they have this idea that hearing voices is the norm within their culture, and they don't ask them about that and they're not aware of that, they could diagnose them, for example, with schizophrenia, and that wouldn't be appropriate. So the new Diagnostic Statistical Manual, so the DSM-5, does actually include questionnaires about cultural background, and psychiatrists now are trying to consider an individual's cultural background when they are diagnosing them. So it's something that they're aware is a problem and they're trying to fix that. So the deviation from social norms definition, it could be culture bound, and culture needs to be considered. We need to consider cultural relativity with that. The next definition is failure to function adequately. A person may be seen as abnormal when they can no longer cope with the demands of everyday life. We might decide that someone is not functioning adequately when they are unable to manage basic standards of nutrition and hygiene. We may also consider that they are no longer functioning adequately if they cannot hold down a job or maintain relationships with people around them. In addition to that, Rosenhan and Seligman in 1989 came up with some other signs that someone is unable to cope. When a person no longer conforms to standard interpersonal rules, so when they struggle to maintain eye contact, for example, when a person experiences severe personal distress, when a person's behaviour becomes irrational or dangerous to themselves and others. An example of when we would use failure to function adequately to diagnose an individual is when we consider intellectual disability disorder. One of the criteria of this disorder is having a low IQ. However, a diagnosis would only be made if an individual was also failing to function adequately. So we often use failure to function adequately alongside other definitions of abnormality to confirm that an individual is displaying abnormal behaviour. In evaluation, a strength is that it gives us a threshold for when people need professional help. Most of us have symptoms of mental disorder to some degree at some time. So I think mine said 25% of us will experience a mental health disorder within any given year. However, many people carry on, and it tends to be at the point when people cannot function adequately that they seek professional help or are noticed and referred for help by others. This criteria means that treatment and services can be targeted to those who need them most. So again, this is an example of a real-world application of failure to function adequately and its usefulness in the real world. A limitation. It's easy to label non-standard lifestyle choices as abnormal. It can be hard to say when someone is really failing to function and when they have simply chosen to deviate from social norms. So, an example of this is not having a job or permanent address. This might suggest that you are failing to function. However, some people with an alternative lifestyle choice would choose to live off-grid. And another example is high-risk leisure activities, for example, base jumping. This could be classed as a danger to self, and it means that people who make unusual choices are at risk of being labelled abnormal, and their freedom of choice may be restricted. So next we have got statistical infrequency. Any relatively unusual behaviour or characteristic can be thought of as normal. So if behaviour is usual, we would say that it's normal. but a behaviour that is unusual we would say is abnormal. For example, we can say that at any one time only a small number of people will have an irrational fear of buttons, therefore this behaviour is abnormal. So when we're looking at statistical infrequency, we're looking at the numbers of people who are within the range of normal according to a normal distribution, and the individuals who are 2 or more standard deviations from the norm would be seen as abnormal, and that could be 2 or more standard deviations below or 2 or more standard deviations above the norm. So that behaviour would be deemed as abnormal. So we're using statistics to determine whether someone has abnormal behaviour. An example of this is IQ and intellectual disability disorder. So we're able to measure intelligence, and the majority of people's scores will be close to the average. The further we go above or below the average, the fewer people will achieve that score. This is called the normal distribution, so you should be aware of what a normal distribution is. This is within your research methods topic, and it's worth refreshing your memory about this. The average IQ is about 100 in a normal distribution. Most people, so around 60%, have a score from 85 to 115. Below, a very low number of people have a score below 70. This is very unusual or abnormal, and these individuals may be diagnosed with intellectual disability disorder. So we're looking at the bottom, like 2% of individuals who have a really, really low IQ score. They could be diagnosed with intellectual disability disorder, and this might be one of the first signs that an individual is suffering from this. In evaluation, so strength is that statistical infrequency is used in clinical practice as part of a formal diagnosis and a way to assess the severity of an individual's symptoms. For example, a diagnosis of intellectual disability disorder requires an IQ of below 70, which is the bottom 2% of the population. Another example of statistical infrequency used as an assessment tool is the Beck Depression Inventory. So if you get a score of 30 plus, which tends to be around 5% of respondents, this is interpreted as an indication of severe depression. It shows that statistical infrequency is useful in diagnostic and assessment processes. So again, just like the other two, this is an example of how we can use it in everyday life, and it shows that this definition is really useful in everyday life. A limitation. Unusual characteristics can be positive as well as negative. For every person with an IQ below 70, there's another with an IQ above 130. And we would not think of someone as abnormal for having a high IQ. In addition, low depression scores would not be seen as abnormal. These examples show that being unusual or at one end of a psychological spectrum does not necessarily make someone abnormal. It means that statistical infrequency may not be sufficient as the sole basis for defining abnormality. So with regards to that, it's kind of like, it's a good method to indicate individuals that we need to look at in more detail, especially with regards to IQ and intellectual disability disorder, but it doesn't give us the full picture because it could just be that they have a desirable characteristic. Or it could just be that they're just a little outside of the norm, but they are fine with everything else. So our example for that, where we need to combine it with another definition, is when we combine it with failure to function adequately with regards to intellectual disability disorder. The statistical infrequency might highlight an individual, and then the failure to function adequately confirms that. So we need to use this definition alongside others the majority of the time. Our final definition is deviation from ideal mental health. So once we have a picture of what makes us psychologically healthy, we can begin to identify those who deviate from this ideal. So with regards to deviation from ideal mental health, we have several criteria that are ideal with regards to mental health, and if somebody doesn't meet these criteria, then we could suggest that they are deviating from ideal mental health. So let's have a little look at these criteria. Jehoda, 1958, suggested that we are in good mental health if we meet the following criteria. We have no symptoms or distress. We are rational and can perceive ourselves accurately. We can self-actualize, so that's your humanistic approach there. We can cope with stress. We have a realistic view of the world. We have good self-esteem and lack of guilt. We are independent of other people. We can successfully work, love, and enjoy our leisure. So we've got several criteria there which someone has to meet if they have ideal mental health. There may be some overlap between what we might call deviation from ideal mental health and failure to function adequately. So some of these things, for example, we are independent of other people, we can successfully work, love, and enjoy our leisure. Those two criteria you might also associate with failure to function adequately. So there is some overlap here, but we have several criteria that we have to meet according to this definition. A strength, so just like the others, its usefulness is a strength. So the criteria is highly comprehensive. We have a really good list of things for us to look at and consider with regards to ideal mental health. So Jehoda's concept of ideal mental health includes a range of criteria for distinguishing mental health from mental disorder. It includes most of the reasons why we seek help with our mental health. An individual's mental health can therefore be discussed meaningfully with a range of professionals who might take different theoretical views. So that means like a psychiatrist, a psychologist, a counsellor. All of these individuals may have different ideas when it comes to diagnosing an individual with mental health disorder, but what this criteria does is it gives us a list that they can all use to compare individuals and to discuss an individual's mental health with that person and with each other. So ideal mental health provides a checklist against which we can assess ourselves and others and discuss psychological issues with a range of professionals. So it's really useful because it just gives us that checklist and it creates a meaningful discussion about an individual's mental health. A limitation. Different elements are not equally applicable across cultures. Jehoda's criteria for ideal mental health is based on the US and Europe. The concept of self-actualization may be dismissed as self-indulgent in much of the world. In addition, the value placed on personal independence is high in Germany but low in Italy. Furthermore, what defines success in our work, social and love lives is very different in different cultures. This means that it is very difficult to apply the concept of ideal mental health from one culture to another. So again, that's something similar to the social norms explanation. We need to be aware of an individual's culture when we're using ideal mental health, because different value is placed on different things across cultures, and also collectivist cultures would have different expectations with regards to family and work compared to individualistic cultures. Okay, so we have looked at definitions of abnormality. So that's deviation from social norms, failure to function adequately, statistical infrequency, and deviation from ideal mental health. You need to know the definitions, an example to support the definitions, and the evaluation points for each of the definitions. With regards to the exam questions, you'll see in your examples that there's quite a few exam questions that use an item, and you have to select information from that item to support the definitions. It could be a longer answer question where you have to discuss the definitions in more detail, and you have to evaluate them also. So there's a range of different types of questions that could occur, and there's a couple of different ones in the worksheet for you to have a look at.